Hello, everybody. My name is Jenny Morris. I'm with the Autism Support of Alabama. Thank you for joining us today. We are so happy to be sharing this information about Social Security. We have some folks from the Department of Mental Health today sharing this valuable information. We have Mary Jane Dasher, Brenda Taylor-Moody, and Nathan Farris. They will go through their presentation and we will end with a question and answer session. Also, for your availability, they have provided some information for you all that's in the webinar document. So you all can access those right now. You can look at them now and you can also download them and keep them. But anyway, save your questions to the end and your questions will go into the question box. And we'll get started. And thank you all, Mary Jane, Brenda, and Nathan. Thank you all for joining us today.
Thank you for having us.
Mhm.
Well, as Ms. Moore said, my name is Mary Jane Dasher. I am a benefit specialist with the Alabama Department of Mental Health, and I'm here with Nathan Farris and Brenda Taylor-Moody. They are both benefit specialists as well. Just to give you some general information, we work with people ages 14 to retirement. We do not do retirement benefits. Our services are free. And it's very easy to do a referral. We have one sheet referral form and two releases if you need benefits counseling. Again, like I said, our services are free. We work with people who receive Social Security disability benefits. We work with SSI recipients and SSDI, and we're going to talk about both of those programs here shortly. We a lot of people want us to help them get on benefits, but we're not allowed to do that. We really, our main focus is work and how work will impact those benefits with the ultimate goal of helping people reach financial security. So we're going to start off today talking about SSI and just the way it usually works when someone receives SSI is just as an example. Let's say that your child is earning $100 a month. The first thing that Social Security does is subtract a $20 general income exclusion, bringing the total down to $80. Then they subtract a $65 earned income exclusion, bringing the total down to $15. So basically the first $85 that a person earns in any given month is ignored by Social Security as though they didn't make it. Then they would take what's left, in this example, the $15, and divide it by half. So the only countable earnings that that person would have would be $7.50. So the SSI would go down by $7.50, but your total income would go up by $92.50. So the good news is with SSI, work is great. The more you work, the more money you will have. And you can even work to the point that you no longer get a check, but that check will be protected by a work incentive called 1619B. And not only does it protect your eligibility for that check, but you're able to keep your Medicaid as long as your earnings remain below $38,244 a year. So we're going to start off. Nathan and Brenda are going to play a little SSI game to show you how it works. Who starts off, Nathan?
Me.
Brenda.
It would be me. So if someone receives SSI and decides not to go to work, the only thing they would receive would be the full benefit rate of $967 for 2025 and their Medicaid. So they won't have any more than $967. And you can only imagine how difficult it is to live off $967 a month. Nathan?
All right. So if somebody's deciding that they do want to work, and we're using this for example, if somebody's wanting to work part-time, 20 hours a week, and minimum wage right now is $7.25 an hour. So if they work 20 hours a week at $7.25, their income for that month would be $628. Social Security will do their thing. They'll deduct the $85, and they divide that in half. So instead of that $967, their SSI check would be $695.50. But their total monthly income would be $1,323.50. So as you can see, by working part-time, their check goes down, but their total monthly income goes up, and they still get to keep their Medicaid.
And let's say they decided that part-time work, they could do full-time work. So that's working 40 hours a week at the 7.25, which is minimum wage. And they're earning, earning 7.25 an hour. So the wages would be $1,256 a month. And then Social Security calculations, as Nathan and Mary Jane have stated, would happen, and the adjusted SSI check would be $381.50. So though the check goes down, again, the monthly income goes up to $1,637.50. And that's with full-time work, and you get to keep the Medicaid there as well.
All right, so this is what's called the break-even point. People always seem to ask, what's the magic number? Well, there's really not a magic number, but if you really want to look at it, so the way to get your SSI check to go down to zero is called the break-even point, and that individual has to make $2,019 for their check to go all the way down to zero. But the cool thing is through a program called 1619B, they're still able to keep their Medicaid. So they make the $2,019 from working, their SSI check goes to zero, and they still get to keep the 1619B.
And they remain eligible for that SSI cash benefit.
Right. That's right.
Okay, now we're going to talk about something called part-time work. Well, part-time work with student earned income exclusion. And let's say they went to work part-time and they made $500 a month. Okay, they would get to keep their benefit check also, because the student earned income exclusion allows you to count the first $2,350 of earned income up to your calendar year maximum of $9,460. And keeping your check, the $967, which is the federal benefit rate, and you get the $500 in wages, you end up with $1,467 a month. And that's pretty good for a student who may be in a program like Project Search, community college, or regular college. So these are things that allow someone to go to work, another incentive that allows somebody to go to work and still receive their monthly benefit and keep their Medicaid.
The student earned income exclusion applies to anyone under the age of 22, so it would apply to high school students as well. But they have to be full-time student or attend a certain number of hours after high school in order to qualify for the student earned income exclusion. We're going to wait.
So a couple of things about SSI that you need to remember. There is a resource limit of $2,000. So if anybody has $2,001 by the first of the month, they could potentially lose their check and lose Medicaid. So that's something very important to remember. So, when people come up and ask us all the time, hey, what do we need to do? A couple of things that I always recommend is opening up a separate account for the individual that receives Social Security benefits. That way, Social Security doesn't get confused on if it's your money or if it's your child's money or the individual receiving Social Security benefits. You have that account set up for them. Something else people always ask is, well, how do they save up for a car? How do they save up, for a down payment on an apartment or the first month rent on that? So there are a couple of different things. You can set up certain types of trusts that are great ideas if you have a lot of money. Another thing you can do is you can set up an ABLE account, and that is a way for them to save up over that $2,000 a month to have money available for them. And if you don't know a lot, research ablealabama.gov. You don't have to use Alabama, you can use other states, but you can only have one ABLE account open at a time. And there are certain, yearly amounts that you can put in. There's a certain overall amount that you can put in. But ablealabama.gov is a good resource just to go and look to see if that's something that you might be interested in, just to sort of hold out where you can have more than that $2,000 in resources.
And $100,000 in an ABLE account is exempt from the resource limit.
Right.
I guess what we really want you to take away from this SSI is that it is possible to work and come out ahead financially.
Right.
Even if your benefits are reduced or, paused, it is possible to work and come out ahead.
Brenda, you want to address wage reporting and the importance with SSI?
With wage reporting, I think it is most important that you report your wages to SSI by the 6th of the month. And so that they can get an accurate count. What is it called?
Retrospective monthly account?
Retrospective monthly. Say it again. Say it.
Retrospective monthly accounting.
Say it 3 times.
Right.
No.
What Social Security does is whatever you earn in 1 month, so whatever you earn in August would get reported in September and it would impact the October check. So there's usually a 2-month delay. There are a few exceptions. One is if you hit the break-even point, but generally, there's a 2-month delay between the time you earn the money and the impact on the check itself.
Right.
Now, one other thing you need to also keep in mind is that we don't just look at the Social Security, SSI, and the health insurance. We look at any benefits that person may receive and how employment may impact those benefits as well, such as SNAP or food stamps, housing, VA benefits, anything whatsoever that's in addition. We just have to have them receiving either SSI or SSDI before we can do that. But we do keep all of that in mind to make sure that people know the exact impact that employment will have on those benefits.
Right.
Okay. So anything else you want to add about SSI?
I think that's good. Oh, work incentives. We need to add work incentives. There are something called IRWIs. That you can help help reduce the impact of working that it may have on the benefits. One that we use as an example on a regular basis is if someone has a dog, what do you call it?
Guide dog.
Guide dog.
Animal.
Yeah, support animal. You can use let's say the food, the vet bills, things like that, that would help offset some of the work, some of the wages, hearing aids, eyeglasses. There's a long list of things that Social Security can take into account that may reduce the impact of wages on your benefit check.
So for every $2 that you spend out of pocket, it will help you retain $1 of your SSI.
Right.
You want to talk about blind work expenses, Nathan?
Yeah. So when it comes to an individual that's blind, there are work expenses that they get over and beyond other people. Like food, their lunch while they're at work. There's just a whole lot more incentives for them when it comes to blind work. Mary Jane, I don't know what exactly you're wanting me to go
That was
off
pretty
of.
much it.
Okay, all right. There's
But
just a whole lot more for blind individuals to be able to use as a work expense. So it really is good to have one of us to come and sit down to talk, to try to figure out things. Mary Jane is really good about finding out of the box things when it comes to impairment related work expenses. If somebody's in a wheelchair and they need like a ramp part of building that ramp is to help them be able to get out of the house, to go to work. Transportation, that can be used as an impairment related work expense. So there's a lot of things that sometimes you do have to think out of the box. Anything that is related to that individual and helping them have the ability to work can be used as an impairment related work expense, as well as a blind work expense as well. And so, thinking out of the box is a good thing. The worst thing that Social Security can do is say, no, that doesn't count. But trying to think out of the box, and even, normal things like Brenda said, hearing aid batteries, glasses, if they have to have special shoes that maybe some of their coworkers don't have, that can be counted as an impairment related work expense. So there's just a lot of things that are listed on the Social Security website and some things that aren't. So it's always good to try to think outside the box for that.
Well, that pretty much covers SSI. So the next thing we're going to talk about is SSDI, or Social Security Disability Insurance. And the ways that you can receive that is either you are a disabled individual, a disabled worker, or you're the adult child of someone who's also disabled or retired or deceased, or you're a disabled widow or widower. So those are the three main types of SSDI benefits that you can get. Unlike SSDI, someone has worked and paid into the system and reached insured status, whereas with SSI, or supplemental security income, it's a needs-based program because it's based on low income and low resources. With SSDI, someone has worked, they have paid into that system, they reached insured status. So the very first work incentive that a person gets is something called the trial work period. And you get 9 months in a 5-year period. They do not have to be consecutive, during which time a person can make and earn any amount of money whatsoever. They could earn $3,000 a month and still keep their full benefits. But how they are measured is any month that a person earns this year in 2025, and these numbers go up every year with cost of living. But anytime they earn over $1,160 in a month, they use a trial work period month. If they work and earn, let's say, $1,200 one month, they use one. The next month they earn $900, they don't. So they all 9 have to be within that 5-year period. If they're not, some of them can roll back to you. We usually play a game to kind of show people how that works. We can't do that in this instance because it requires throwing balls. I don't have anybody to catch them over here. But anyway, after you use all 9 of those months, that work incentive is gone, and you immediately go into something called the extended period of eligibility, which lasts for 36 consecutive months. And during that time, Social Security starts measuring something we call substantial gainful activity, or SGA for short. There's a number attached to it. This year, that number is 1,620. Again, that will change in January. It will probably go up. But for any month during this 36-month period, any month that you earn over 1,000 at or above 1,620, you would not get a check. The next month, if you earned under, you would. So you can kind of go in and out of pay status during this period of time. But if you ever have a pattern where month after month after month, you're making at or above that 1,620, Social Security can make what we call the SGA, or the substantial gainful activity decision. And it is a decision because it's made based on a pattern of work, not just a number. And if they make that SGA decision, that per individual would get 3 more checks, and then the cash benefit would be suspended. It's not terminated during the extended period of eligibility. It's only suspended. So if something were to happen at any other point during that 36-month period, and that person stops working at or above that SGA number, they would simply contact Social Security, tell them they're no longer working above SGA, and their benefits would be restarted. So there's no need to reapply. If everything is going really well and they're still working above SGA, and they reach the end of that extended period of eligibility, at that point in time, their cash benefit would be suspended. Now, the health insurance can continue for approximately 93 months from the end of the trial work period. If someone, reaches that SGA decision. And sometimes if the SGA decision is made later, it can go up to 78 months. But if they never go over that SGA, their Medicare continues. All right, so at the end of the extended period of eligibility, let's say the person is still working and earning over $1,620 and their cash benefit gets terminated. You have another 5-year period called expedited reinstatement, or EXR, during which time if a person's earnings drop below SGA, or they have to quit work altogether, whatever it may be, they can get back on their benefits through something called the expedited reinstatement. They would contact Social Security, tell them they need to get back on their benefits through EXR. There's a lot of paperwork that has to be done, just like when someone initially reapplies. The difference is, while Social Security is doing that medical review to make that decision, they have to pay the individual. So you're not going for months without any money. They're going to pay you, and they have 6 months to make that decision. If they cannot make it in 6 months, they have to continue paying them for longer. Then once they make that, they decide that the person still has the same disabling condition or one similar to it, and they get their benefits are restarted. After 24 months of what we call EXR payments, they get a whole new trial work period and a whole new extended period of eligibility, and the whole process starts all over again. Now, back to the extended period of eligibility and measuring SGA. Let's say that a person is earning more money than the SGA amount. There are ways that you can do that and still have countable earnings below SGA. One of them is, just like with SSI, you can use impairment-related work expenses. So if you had someone who was making $1,700 and maybe they were paying out of pocket $200, that money would come off the top, and then Social Security would only look at $1,500, even though they made $1,700 because of the impairment-related work expenses. They'd only look at $1,500. There's another even more powerful work incentive called subsidy. So let's say that you have an individual that's getting quite a few accommodations. For instance, I have people who work with the Alabama Industries for the Blind. And because they are blind, they get a whole lot of accommodations so that they can do that job. And so they get something called subsidy. And what the employer does is they look at that person and compare them to another person who's doing the same job, and would say, without these accommodations, what would this person's productivity be? And they can do any percentage from 5% to 95%. But if they said that person's productivity is 75% of another employee, then Social Security is going to ignore 25% of their earnings. So if they're making $2,000 a month and they have a 25% subsidy, Social Security is going to look at $1,500. They're below SGA and their benefits continue. My folks at Alabama Industries for the Blind, their productivity is usually compared at 25% of other people, which means 75% of their income is ignored. And so they could make $2,000 a month. Social Security is only going to look at $500. Okay. All right. Is there anything I left out?
So with SSDI, they receive Medicare. Medicare is different than Medicaid. There are 4 different parts. There's a Part A, that's for hospitals. Part B for like doctor's visits, lab, and outpatient, ambulance. Part C is a voluntary managed care package. Part D is prescription drug plans. So there are different ones. They're not all automatic. They're all not free. Some of them are. It depends on your earnings. It depends on your check. But Medicare is different than Medicaid. So that is with SSDI. If they're just starting to receive SSDI, there is a 24-month waiting period. Unlike SSI, where Medicaid starts automatically right away. So I think that's the only thing that I noticed that you left off was health insurance.
Right. And well, there is one thing too, that we also have something called the Medicare Savings Program. So depending on
Right.
what a person earns or what they're receiving in SSDI, if they are eligible for a Medicare Savings Program, Alabama Medicaid will come in and pay their Part B premium, which is really nice. And if they're eligible for that, then the Center for Medicaid and Medicare Services will come in and pay their Part D prescription premium. And that keeps those prescription costs down really low. All right. And also, there was something else I was thinking about, and I just went straight out of my brain. Brenda, can you think of anything?
That those programs can be applied for online. The Medicare Savings Plan and the prescription Part D. It's not a long form, but yeah, you have to go through Medicaid services for Alabama in order to apply.
I know what I was about to say. Sometimes you have people who start off with SSI and they're working, or either they have a parent that retires. And if the parent retires, they usually have something called a family benefit. So that person who is receiving SSI, which was needs-based, will transition to SSDI as a disabled adult child. And then they're in that two-year waiting period for Medicare. The good news is, if that happens, because they're receive a disabled adult child benefit, they still qualify for Medicaid. You just have to file a certain application called an E&D application for continuation of Medicaid. A lot of people don't realize this, but it's a good way to make sure that there's no gap. And even after their Medicare starts, they can keep that Medicaid. And with all of these things that we talked about, sometimes we have people who are what we call concurrents. They receive both SSI and SSDI. So all of these work incentives that we discussed would apply to both sides of the table, which can get really pretty confusing, which is why it's good to have somebody like us work with them.
Yeah.
I think
So like SSI, SSDI, it is good to report your wages by the 6th of the month. You will occasionally find a caseworker that wants you to do it all at the end of the year. Our recommendation is always do it monthly. That way they know how much you're earning, mainly if it's close to trial work period, if they're still in that phase, or if they're close to SGA, if they've used all 9 trial work period. It's always good to report your wages. That way that they can keep a handle on it, hopefully in a timely manner. That way you don't have to worry about overpayments or anything like that. So really a good summary is SSI and SSDI, they treat income differently. SSI is when that individual is paid the money. SSDI is when that individual actually earned that money. So even if they got paid like after the first of the month, they still would report their earnings based on the days that they worked, and not actually when they get their check. So paid employment and Social Security disability benefits, they're not mutually exclusive. It's possible to work and keep your Medicaid and your Medicare in almost every case. And like Brenda said earlier, it's possible to work and come out ahead financially, even if your benefits are reduced. And even if benefits are lost due to work, it's possible to get those benefits back again. So that's sort of a summary of it all. I guess now's a good time to open up for questions. I have not seen any questions yet come up in the chat, but if you have questions, please post them now. That way we can hopefully answer any questions. Just sort of, I guess, to re-go on what Mary Jane said, now's your time to ask questions. I'm going to try to talk a little bit while y'all post if y'all have any. But application process. So we have a referral form that we would like for individuals to fill out, and a release form. So there's 2 release forms that need to be signed. So usually the process, you fill those forms out, get them to us. We have to send that to Social Security to get verifications back, so we know if what they're receiving, what benefits they're receiving, the financial amount, if they're receiving Medicaid, Medicare, and then once we get those back, then we'll contact the individual to go over questions, answers. Then we can contact Social Security. So if you get any things from Social Security that's sort of confusing, we can help answer those. All right, so somebody asked a question, how old do you have to be to get SSI? Mary Jane responded with any age depending on parents' income. Does that answer your question?
Yes. Okay.
Okay. Y means yes, or Y means why?
Well, I
Does-
mean,
and-
yes.
Thank you. I'm still trying to learn the lingo of text messages and all that. My 13-year-old tries to teach me what everything means nowadays. Good question. Any other questions?
Of course, one thing we did leave out is we will also do financial literacy classes as well. If anyone needs that kind of assistance. Of course, we do the benefits counseling, and a lot of times people initially contact us because suddenly they have an overpayment and they don't understand how that happened, and we can kind of help dig into that and see what's going on. And if it's an issue that can be resolved, we can help with that as well. We do have direct contact with most of the Social Security offices. So do you have to use your Medicaid if you have private insurance? Well, it's great to use it as a backup because whatever your
Right.
private insurance doesn't pay for, Medicaid may. Of course, not every office will accept Medicaid.
Correct.
But sometimes if you have private insurance, what is that called? Do you remember there's a program that Medicaid has that they will, if you have a child that receives Medicaid, they will come in and pay your private insurance premium for you. Do y'all remember what that's called?
No.
No.
The process to apply for Social Security. Oh my goodness, it can take up to 2 years, unfortunately. And I will tell you that although Social Security claims that they do not do this, generally a person, as soon as they apply, they get declined. And what we tell people is they're trying to find out who's going to walk away. So a lot of people get discouraged as soon as they get that denial letter and just hang it up. But we always say, just go ahead. If you really feel like your child needs those benefits, go ahead and appeal. If the appeal gets denied, that's when you need to reach out to a Social Security attorney, but I wouldn't do so beforehand. Is there another group like yours that helps caregivers of disabled children apply for benefits? Well, benefits counseling, no benefits counselor can do that, but I'm sure there are, different agencies that might be able to help. Maybe Easter Seals. Can y'all think of anybody? Some of the
There's probably lawyers' offices, disability lawyer offices that probably help people apply for benefits.
for
But that's
for a
sort of
fee.
right. Yeah, that's sort of outside our realm. I mean, I guess our role is to help individuals when it comes to them already receiving benefits and how working affects those benefits. We don't really now if they had benefits and they lose them, we can help them get back on their benefits or to try to find out what happened to them losing their benefits. But as far as the initial startup of getting on SSI and SSDI, that's something we just really
Yeah, we
don't
don't do.
do.
Someone just answered the question. ALHIP, that's the program that helps pay for families private insurance if a child has Medicaid. Another question: if you receive SSI, how can you get benefits increased or reviewed for an increase? One thing we failed to mention: there is something called in-kind support and maintenance. And so, if you have a child that's living with you and you provide any type of support for, then Social Security will come in and say, okay, they're not able to pay their expenses. So in such Social Security logic, they're going to take away 1/3 of what they get. And it's usually like, is it $690 something? What it is this year. But yes, there is a way you can get those benefits increased. We use a flat rate rental agreement, and you only have to use 1/3 of the value of Social Security as the rental amount, and you can submit that to Social Security. We actually have a form that we use, as well as a list of questions with suggested answers that we send out to people. Like, for instance, we have had people who've done a flat rate rental agreement, and they're charging for the room and the use of the bathroom and use of the common areas, and maybe they're charging $400 a month. And then Social Security calls them and say, okay, well, if you were to rent that same room to someone else, would you charge them more? And they've said yes, which means they're still providing in-kind support and maintenance, and that benefit amount will not be increased. So you would not be able to rent any other room in the house for more than what you charge your child, or you would not be able to get that amount increased. And then, of course, there's some other questions they may ask too, and we send suggested answers for those as well.
Right. But the full benefit rate for 2025 is 967. So there's no way for them to get more. If your question was increased outside of that in-kind support, if it's more than 967, that is the maximum amount. There's no way to get more than that full benefit rate of 967.
Not until the new year starts and you get the new
Right.
COLA. And there
Right.
has been at least 1 year in the past where there was no COLA adjustment. We will find out what will happen this January. I'm not sure with whether or not there will be an increase.
Good questions. Anybody else?
That number for the in-kind support and maintenance for this year is 645.
Oh, is it 645? Okay.
All right.
Any other questions?
Well, thank you all for your time today. We had a lot of participants. Hopefully we got everyone's questions answered with the information that you all provided for us. And we thank you for your time, Mary Jane, Brenda, and Nathan.
And also to let you know that if someone does have a specific question, you're welcome to share our contact information with them.
Okay, well, super. I know with one of the handouts that we have Brenda's information. And so if you guys need anything, reach out to Brenda and she can connect you with Mary Jane or Nathan. And so can we. So you can reach out to info@autism-alabama.org if you would like us to send you the information and email addresses for the our folks today from the Department of Mental Health. All right, wonderful. Well, thank you guys for joining us today, and we'll see you for our September webinar Wednesday. Take care.
Thank you for having us.
Thank you.